Hello, Diaz here, founder owner Greenwood Dental. Welcome back to another episode of my POP series. Today I would like to walk you through the process of how we diagnose oral cancer. And the reason why I decided to do this episode, a lot of the patients that comes through our practice with a concern about a lesion or a cut or redness in the mouth, automatically they think cancer because it's not going away. But most of the time, it's not. However, I want to go through the process again of diagnosing something like that so you guys are familiar and comfortable with the steps. Because again, the fact that you have a lesion that's not healing or changing color or changing shape is very concerning and very stressful, and you guys come in with a lot of anxiety, and sometimes you're just not listening because you're so anxious. So if you have a lesion anywhere in the mouth, whether it's in the cheek, under the tongue, in the roof of the mouth, on the gums, in the throat, it will be very obvious that something is wrong, meaning that if the soreness is not going away, if the cut or the sore spot is changing shape, meaning that it's opening up or it's spreading or has like kind of mushroomy look, that is very concerning. But if there's a lesion that you get on and off, depending on certain stressors, or you're on medications, or a dramatic change that happened in your life, then that's not as concerning as a lesion that's been there for a long time and it's changing, like I said, color, and it's changing shape. So when you guys come in, obviously we take a look, make sure we rule out the source, which is either tooth, nerve, or bone, gums. If we rule out these two, then we start taking a look at the shape or the appearance of that lesion. Certain lesions are 100% associated with precancerous cells, and certain lesions are directly associated with immunity, with bacteria, with just a straightforward infection like an abscess. That's the one that you guys are very familiar with. So when you come in, and if somebody comes in with a lesion and you guys are very concerned about this not going away, again, when we take a look at it, depending on the color and the shape, we decide to send to an oral surgeon in order to do a biopsy. We had a patient that for the longest time had a sore throat all the time. And we couldn't figure out why, but when we looked at her mouth, it was lesions everywhere. And you can tell just by the appearance, it doesn't have a shape, it doesn't have an order to it, it's just random, all over the place, and it looks very metastasized, very mushroomy appearance. So that becomes a concern. Unfortunately, these lesions are last stage of cancer, which is a stage 4 cancer, whether throat or mouth. But if you have a lesion that you guys are concerned about and you want us to take a look at it, again, we rule out the two things, and then we send it to an oral surgeon, and it's up to the oral surgeon whether they decide to do a biopsy. Sometimes the lesions are not even worth biopsying. It will be more painful to heal from the biopsy cut than the actual lesion if they think it's not benign, and it is, if they think it's not malignant, it's benign, or it's just an oral lesion that's going to heal with either antibiotics or steroid ointments or mouth rinse. So again, it's up to the oral surgeon, and we have to follow the oral surgeon recommendation because they are the experts. Now, that said, through the years, many cases that I sent to an oral surgeon, they do a biopsy, and it's worth taking a tissue out of it as a sample to send it to the pathology lab, but nothing comes out of it, which is fine. That's really good news. However, these patients, we still track them. We still keep an eye on them. Every 6 months, we check the site of the lesion and make sure there's no changes, because even though in the early stages or the first visit, we could not find anything, or the first biopsy couldn't find anything, it doesn't mean that it's not brewing. So if it repeats itself, then that becomes a pattern or concerning pattern. Then we can address it again. So I hope it's very complicated. I don't want to get into the pathology of it, but I just want you to have some kind of a guideline and expectations. God forbid if this happens and you're very concerned, you'd rather check it out earlier than to let it go. The main causes that we are concerned about is habits. Tobacco, chewing, smoking, vaping, and also alcohol intake. Those are very harsh irritants that can, the years and years of those habits can definitely aggravate your system and cause the change in the appearance of things in the mouth. So I hope that helped. I hope that clarifies some of the confusion. Again, if you have any questions, please reach out to me with the comments below, or you can always give us a call and be very happy to take a look at anything that you want us to take a look at and direct you in the right direction or send you in the right direction. So that's it for today. We love you. Be safe and DS out.